what would someone expect when they come and see you? If they have incontinence, what are some questions you would kind of ask? What are some testings? And then kind of what's your solution?
So the most important thing is, what is it? What type of leakage is it?
Okay.
And how is it affecting them? And when
Okay.
I say how is it affecting them, I go from what are they drinking, how much and when, what are the type of urinary symptoms they have,
Okay.
when does it happen, where does it happen, and how much do they think it affects them. And if they have multiple urinary symptoms, it's very important to understand which affects them the most, because that's what you try to treat first. And so if you talk about treatments, this is, so go back for a second. So in addition to those questions, we also want to know in detail sort of how many pads they're using. Are they thick and thin? We want to know about their medical history, their surgical history, of course. Have they had children? If so, what form of delivery? Were there any complications? Family-associated history, all of that.
Okay.
And then we talk about treatments, it's important to know what, it sort of is based on what the problem is.
Right.
And so if in general terms, we talk about stress incontinence and urge incontinence. And then,
Okay.
of course, difficulty emptying your bladder.
Right.
Not being able to empty your bladder.
Yes.
And another common one people come in with are recurrent UTIs, recurrent urinary tract infections.
Okay.
And so if I was to define for general terms, stress incontinence is leakage when people are coughing, laughing, sneezing, lifting. Sometimes they'll say it occurs during orgasm. Sometimes they'll say it's when they're jumping with their kid on the trampoline.
Okay.
That's stress incontinence. Urge incontinence is the classic, I'm washing dishes and I feel like it's coming. Or I feel like I gotta go and I can't make it. I get to my door, I'm coming home from work, and I start to turn the keys, and I don't think I can make it to the bathroom.
Okay.
Okay? That's urge incontinence.
Okay.
Many women have a mixture of both.
Wow. Oh, all right. Lots to go over, which is, it's really good because I think a lot of females don't talk enough about it. And they don't know the difference between stress and urgence, or it's all kind of the same.
It's hard to
So you-
differentiate sometimes.
Yeah. Okay. And so then, if I have stress incontinence postpartum, what would be a treatment, just as an example?
So, of course, a majority of postpartum leakage acutely resolves.
Okay.
There are women, many women get stress incontinence, and so if it doesn't resolve, I usually will encourage them to do pelvic floor physical therapy first.
Okay.
And just look at their overall habits. And again, that's a common time where women don't have time for themselves. And so therefore they're putting off urination, they've developed some bad habits. Tried to straighten all those things out first, of course.
Okay.
Another huge one that I have not mentioned is constipation. Constipation heavily affects urinary function. And so,
Okay.
and that's a common thing. Any GI doctor will say that many, many, many Americans are constipated. And so what is constipation? I say you need to have a soft poop every day.
Every day.
Every day, a soft poop. If
Okay.
you're not, something we can fix.
Yeah.
And that can help.
Wonderful.
But yes, with pregnant women, I would say the most important thing is first trying to sort of ride out and give their things a chance to heal.
Okay.
Pelvic floor physical therapy, which can start even, soon after.
Okay.
And then beyond that, after about 6 months, say 9 months, if things still haven't gotten better, the discussion really becomes, are you still planning on having more children? Where are you in the whole fertility
Okay.
aspect of your life? And what are the treatment options? And so they could be anything from, like we said, pelvic floor physical therapy,
Yeah.
to, as you get older, for anybody with stress incontinence, is something called bulking injections.
Okay.
The term for that is called Bulkamid, where we go in with a camera, and it can be done in the office
Oh.
with local numbing. It works immediately. It's effective for a long time.
Okay.
And then beyond that is something called slings, which we
Okay.
can either use artificial tissue or your own tissue.
Okay. All right. So now, on the opposite side of that, you're a female, you're 80 years old, you've had 2 kids, and you are just incontinent all the time, all day, every day. You're going through pads, blue pads, in your bed. You're wearing a diaper. You're going through it. It is affecting you socially. You can't go out. And you're just, UTIs, you're having infections back to back to back, in and out of the hospital. What does a treatment look like for someone that comes to see you with that issue?
So the biggest problem with that is that when people are incontinent that way, they're more likely to try to go to the bathroom more often or at night, and they fall. and they fall and they get a hip fracture. And then they end up institutionalized, they get pneumonia, and we have a poor course. So it is a huge problem in the elderly with incontinence when they don't get to see somebody.
Yeah.
But the first thing, just like what we talked about with any other woman, is the history. Is
Yep.
what
Okay.
type of incontinence, when is it happening, what is the biggest issue?
Okay.
And then again, the stress incontinence is the same approach with behavioral modification, physical therapy, and our other treatment options.
Okay.
Then we talk about urgency and urgent continence, again, behavioral modification. Then we have medication options. If people had read, there was a period of time where people worried about certain medications increase the risk of dementia over the age of 65. But
Okay.
that does not by any means mean all of the meds. So people shouldn't be scared to come. We have many options.
Right.
And then beyond that, we have 3 different neuromodulation type concepts. And what that basically means, as the word says, neuro and modulation. It's a way to affect the nerves that help with bladder function. So we have 3 methods. One is an acupuncture type concept in your ankle. And in fact, the needle's smaller than an acupuncture needle, so you don't feel it. They come in, they bring a book, they sit for 30 minutes, and they do that for 12 weeks. And if they like it, they do it every month. All
Okay.
of these things are covered by insurance.
Okay.
Another is something called Botox, which is injected into the bladder,
Okay.
which is not absorbed. So
Okay.
like the acupuncture concept, it is not something that has systemic effects.
Okay.
Botox does have a small risk of difficulty emptying, and so we talk about that, but most people really like it because it lasts 6 months. And then there's something called sacral neuromodulation, which is beautiful because it lasts for a long time. We're talking over 15 years.
Oh,
And the
wow.
nice thing about it is a little device that's implanted, but it's MRI safe. You can go through airport security. It is
Good.
pretty much a great thing without limiting what it used to limit. So there's been a huge improvement in the technology associated with it.
Oh, wonderful. It's nice to know there's options.
Lots of options.
Especially getting back to just your normal daily living
Yes.
at that age, you know?
And if you were, I would say, part of what drew me to this field is what a huge impact it makes on people's quality of life.